This presentation examines our research by Isola et al. On hormonal changes during competition preparation in physique athletes. The study provides valuable insights into how hormonal profiles shift during intense caloric restriction and training, with significant implications for coaching methodologies and athlete health. We examined both female and male physique athletes throughout a complete competition cycle. We sought to understand how the rigorous diet and training regimens affect hormonal profiles and how these changes impact physiological function and performance. Understanding these mechanisms can help us develop more effective and safer preparation strategies for our athletes. The study design was robust, following athletes for nearly a year through preparation, competition, and recovery phases. Control groups of similar training backgrounds who weren't preparing for competition provided valuable comparison data. The comprehensive measurements included not just hormones, but also body composition, performance metrics, and psychological indicators, giving us a complete picture of physiological changes. Energy availability is calculated by subtracting exercise energy expenditure from energy intake and dividing by fat-free mass. This metric is crucial because it directly impacts hormonal function. Both sexes experience significant reductions in EA, with males reaching lower values than females by competition time. Note that both groups fell below the 30 kilocalorie FFM day threshold associated with endocrine disruptions. For coaches, this highlights the importance of periodizing diet plans to minimize time spent in severe energy deficits. The study revealed distinct patterns of hormonal changes, with some affecting both sexes and others demonstrating clear sex differences. IGF-1 and its binding protein decreased in everyone, while testosterone, free testosterone, insulin, cortisol, and TC ratio changes were predominantly observed in males. The good news is that these changes were temporary and reversed during the recovery phase, suggesting that while competition preparation does disrupt hormonal balance, these disruptions don't appear to cause permanent damage when proper recovery protocols are followed. IGF-1, insulin-like growth factor 1, emerged as a particularly important biomarker, decreasing significantly in both sexes. What's especially relevant for coaches is that these decreases correlated with fat-free mass loss. In practical terms, this suggests that monitoring IGF-1 could help identify when an athlete's preparation is becoming too aggressive and potentially causing muscle loss. While frequent blood tests aren't practical for most, strategic testing at key points during prep might help identify athletes at risk of excessive muscle loss and inform decisions about implementing diet breaks or refeeds. Male competitors experienced significant reductions in both total and free testosterone, along with increases in SHBG, which binds to testosterone and reduces its bioavailability. This creates a significantly less anabolic environment during competition preparation. Practically speaking, this helps explain why male athletes may have a harder time maintaining muscle mass during extreme prep phases and suggests that males might benefit from more gradual approaches to contest preparation with strategic implementation of diet breaks to temporarily restore hormonal balance. The testosterone to cortisol ratio is considered an important marker of the balance between anabolic and catabolic processes in the body. The dramatic reduction in this ratio observed in male athletes, over 50% decrease, indicates a significantly stressed physiological state. From a coaching perspective, this suggests that male athletes may require more careful management of training volume and intensity during the final stages of preparation. Consider reducing training volume while maintaining intensity to preserve muscle mass and performance while minimizing additional stress on an already stressed system. The reduction in insulin levels, particularly pronounced in males, reflects metabolic adaptations to energy restriction. While this enhances fat utilization, it also creates challenges for glycogen management that can affect training quality and recovery. For coaches, this underscores the importance of strategic carbohydrate timing around training sessions during competition prep. Consider implementing carbohydrate periodization strategies where intake is higher on training days, particularly around workouts, and lower on rest days to optimize both performance and body composition outcomes. Both sexes experienced significant reductions in strength during competition preparation, with decreases in both isometric and concentric force production. What's important for coaches to understand is that these decreases are normal and expected during extreme preparation phases. Trying to maintain maximum strength during peak cutting phases may actually be counterproductive and increase injury risk. The practical approach is to adjust expectations and loads accordingly while maintaining proper technique. Focus on preserving training stimulus through adequate intensity rather than trying to maintain pre-diet performance numbers. The psychological impacts of competition preparation showed interesting sex differences. Males experienced increased fatigue and tension, while females actually showed decreased tension. These different psychological responses suggest the need for sex-specific approaches to mental support during preparation. For coaches, implementing regular monitoring of subjective well-being through simple questionnaires can help identify athletes who might be experiencing excessive psychological strain. Teaching stress management techniques and adjusting training and diet based on psychological feedback may be particularly important for male athletes in the final preparation stages. The good news from this study is that all the measured parameters, hormonal, performance, and psychological, returned to baseline levels during the recovery phase. This indicates that the disruptions caused by competition preparation, while significant, are temporary when adequate recovery is allowed. For coaches, this underscores the importance of programming proper recovery phases between competitions and resistance to the athlete tendency to immediately begin prep for the next show. A minimum of several months of maintenance or surplus eating appears necessary for full physiological recovery. While frequent blood testing isn't practical for most athletes, strategic monitoring at key points during preparation can provide valuable insights. IGF-1 and IGF-BP3 emerged as particularly consistent indicators of physiological stress across both sexes. For daily monitoring, tracking strength performance and subjective well-being provides practical alternatives that don't require blood draws. Consider implementing standardized protocols where athletes regularly report subjective measures like mood, fatigue, hunger, and training quality, which can help identify when adjustments to diet or training might be needed. Based on these findings, several evidence-based strategies emerge for coaches. First, diet periodization appears crucial. Implementing planned diet breaks or refeeds may help maintain hormonal function. Consider 1 to 2 day higher calorie phases every 1 to 2 weeks during preparation. Second, training should evolve throughout preparation, maintaining intensity while reducing volume, as preparation deepens, helps preserve muscle mass while acknowledging the reduced recovery capacity. Third, post-competition recovery needs to be structured and prioritized. A well-designed reverse diet that gradually increases calories while monitoring body composition helps prevent unnecessary fat gain while restoring hormonal function. This research clearly demonstrates the need for sex-specific approaches to competition preparation. Males experienced more pronounced hormonal disruptions and psychological impacts, suggesting they may benefit from more gradual approaches with strategic breaks. Females showed greater resilience in some hormonal parameters, but should be monitored for menstrual dysfunction as an additional health indicator. The traditional approach of treating all physique athletes the same way appears suboptimal based on these findings. Coaches should tailor preparation strategies to account for these sex differences, potentially allowing for more aggressive approaches in females while implementing more measured, periodized approaches for males. The most important takeaway from this research is that while competition preparation does cause significant physiological disruptions, these appear to be temporary when appropriate recovery is implemented. IGF-1 emerged as a particularly useful biomarker for monitoring preparation stress across both sexes. The study highlights the importance of individualized, sex-specific approaches to preparation, with males potentially requiring more carefully periodized approaches due to their more pronounced hormonal responses. Practically speaking, coaches should implement strategic monitoring, periodized dieting approaches, and adequate recovery protocols to optimize both competitive outcomes and long-term athlete health.